Hi, I'm your host, Marsha Florence for Just Ask. Today's show, ladies and gentlemen, is Just Ask the Doctor. Hurry back and join us. Hi, I'm your host, Marsha Florence for Just Ask. Today's show, ladies and gentlemen, is Just Ask the Doctor, and we do have a doctor in the house, Dr. Cynthia Shelby-Lane. Good morning, Dr. Lane.
Good morning, Marsha Florence.
Glad to see you.
I'm glad to see you too.
Okay.
Long time.
Okay. Now, I know people's like, they must know each other. Yes, we do. Okay, now, what I came to have you here today because we have a segment called Just Ask the Doctor, and you are a doctor. So can you tell us a little bit about yourself, and then we're going to go right into what brings you here today.
All right, so I am a medical doctor, physician. I graduated from the University of Michigan Medical School, MGO Blue, and went on to train to be a surgeon at the University of Texas, came back to Michigan, and practiced emergency medicine in Detroit for 25 plus years. And then I went on to become a functional medicine doctor, so I had to go back to school. You know what that's about, more training, so you're never out of school as a doctor. And I practice functional medicine, anti-aging medicine, and now marijuana medicine.
All right. So today's topic, today's topic pretty much is what?
Today's topic is an exploration into alternative solutions for healthcare problems and the legalization of medical marijuana here in the state of Michigan, which already is legal, but we're just looking at exploring the uses, the possession, the cultivation, everything that's related to become a medical marijuana patient and how it works for your health.
Okay. Now, uniquely, what we're seeing is that are more physicians getting into this method more or less, or are you one of the catalysts trying to get them over into this?
There are not many physicians that even understand the medical uses of marijuana, so I am really a novice. I started this maybe about a year ago. Actually, I started probably 5 years ago just being interested and curious because I was already doing alternative solutions. So I would do hormone replacement therapy and alternative solutions for weight management, cardiovascular disease, diabetes, really healthy kind of stuff, prevention. But then marijuana came up as a topic, as a solution for some of my patients. And I wasn't really abreast of any of the uses, so I had to go back to get that third education. And so that's what I started to do, to look into what marijuana really does for the human body, the mental, the physical, as well as, there's a lot of political, legal, and social aspects to having marijuana as a therapy for people. And we're talking about adults and maybe sometimes even children.
Okay. So really, we know that marijuana exists for all different reasons, but at the medical level, are we struggling with the fact that the way people have to ingest it, or are we struggling with the fact, does it cure or does it just deadens the pain if someone is in deep pain or depression?
Okay, so let's go back in history to marijuana 10,000 years ago. It was like God's herb, and so it's on the planet. So what was it used for centuries? We don't really know, but we know that Queen Victoria used it for, I think, menstrual cramps and other problems. And then when it came to the United States, making it legal, that's in the early 1900s, around 1915 to 1927. It was when they said, no, we can't really have hemp and marijuana as a substance that people can have full control of. So the Hearst family, the Hearst so they had more or less, they had industries in wood and pulp and paper. And then hemp was a cheaper way to get things done. Well, they said, wait a minute, you're messing with our money. You're messing with our income. So that's when marijuana became prohibited, similar to what alcohol.
Okay.
So it's like prohibition. At that point, then in 1936, I don't know if you ever heard of it, it's a movie called Reefer Madness. Reefer Madness is a movie. You got to look it up. You gotta look it up.
Okay, Reefer Madness.
Reefer Madness, and they wanted to prove that marijuana made people go crazy. THC, the THC component, the psychotic component, that it made people go crazy. They were hallucinating. It wasn't really good. So by doing that, it really pushed it into the level of the government to make sure that marijuana could not be in the hands of the people. One for political reasons, one for financial reasons, and then they said, well, maybe there's something medically wrong with it. Then we get into the era of Reagan. I like the political stuff.
I see. I think our viewers will be all in too. Like, where she went way back.
Because I had to study this to make sure that I'm on the right path.
Right. In order for you to get to the level that you are with it for your patients, you need to do the history and the study of it. And I can understand that because a lot of people wouldn't understand. Well, how does a doctor say it's okay and the rest of them saying no way? So that's what were you going to say about the Reagan administration?
So they came, just say no. You know, Nancy and Ronald Reagan, and then George W. and then Clinton, they still made it prohibitive. But marijuana, somewhere in the 30s and 40s, became a Schedule I drug. So what does that mean? That means the DEA says it is a drug of high abuse. So really? So the drugs that I prescribe are of low abuse, but marijuana who's killed nobody. Nobody's ever died from marijuana. Zero.
Okay.
Zero. Huge.
Okay, zero.
And 100,000 people in the past year have died from properly prescribed medications. Maybe 40+ thousand died from Schedule II and III drugs that were properly prescribed by doctors, physicians such as myself. So I said, I got to get involved. I got to figure this out. I got to figure out why it's so bad and how can I really be on the front line of healing people. Although, you know, my colleagues probably look at me as like, well, you know, she's out there again doing something that's not really right.
Step away, okay. But, you know, not so much because someone else or quite a few others will, you know, believe in what you're saying. You just so happen to be the one that stepped out on faith to make a valid point. And I'm sure our viewers will make a point too. You know, are they in favor or some saying no way? But as the legislation goes, there's a lot of families, especially moms, on the steps of the governors and saying, hey, you need to legalize this because my child who has epilepsy or autism or Tourette's or something else needs this substance so that they can calm down and have a productive day or life.
Right, absolutely. So in 2008, that's when Michigan decided to take the criminal aspect out of a patient having a medical need for marijuana so that if you use it, possess it, cultivate it in small quantities, then you won't be arrested. But it has to be a bona fide patient-physician relationship. You just can't walk in and say, I need marijuana because I need marijuana. Because I need marijuana because I need a certificate. It doesn't work like that. It has to be a bona fide physician-patient relationship. That's MD or DO. It's not a psychologist or psychiatrist can write for that. And so I have to understand what the need is in the body and the mind for a person to be able to use marijuana without being a cannabis use disorder type of person. You know what I'm talking about.
Okay. Cannabis use. Okay.
Yeah, cannabis use disorder because that does exist. But there are categories now with the state of Michigan, category A, B, and C, that qualify a patient to be medically able to use marijuana in their home and have possession of marijuana.
Okay, that's pretty good. I mean, you know, I think a lot of people are, you know, upset about the fact that here in Michigan, especially in Detroit, you can walk every 8 blocks and find a dispenser and start saying it's just too much going on. Now they're closing some of them down. But I wonder, and I've never had a chance to go into one, but I wonder when you go into one, are they, I guess they have to be licensed to have the place in the first place, but how experienced or knowledgeable are these individuals who conduct, you know, the business inside a facility?
So I can't answer that question because I know there are a lot of dispensaries that are popping up all over the place, and I know that the Detroit City Council has come up with legislation to close some of them down. You can't be within 1,000 feet of a church or school. So there's a lot of legislation going on. But I actually work in a dispensary, and so you can't imagine here's my doctor's office, and here's my doctor's office that's actually a dispensary. And the guys that I work with love them to pieces. Love them to pieces because they've taught me a lot. I asked a lot of questions. I'm there to learn. I don't smoke marijuana, so I just have to put that out there. I have no medical need to smoke marijuana. But I see the types of patients that are coming in. I'm like, wow, this is fascinating to me, because the patients are teaching me, and then I go back and read, and the patients teach me. So every day I probably get about 5 or 6 emails from different organizations in the country, from Colorado, California, Nevada, national organizations, to help educate myself. I'm reading books, I'm going to conferences out in Jamaica. Okay. And I'm just learning more and more about the real need to make this something available to people, so that the stigma's gone, and people who really need it can get it. But I'm still on the medical aspect, medical marijuana, not just recreational at this point.
Well, I tell you what, we're going to take a break, and ladies and gentlemen, when we come back, we're going to get some more good information about medical marijuana. We'll be right back. Everybody needs a helping hand. Take a look at your fellow man. Tell me, what can I do? Courtesy. Pass it on. And welcome back to the show. If you're just not joining us, we have Dr. Cynthia Shelby-Lane on Just Ask the Doctor. And Dr. Lane and I are talking about medical marijuana. So, of course, this is a hot topic in the state of Michigan. And, ladies and gentlemen, I suggested you write or give us a call, 1-800-323-5336, 1-800-323-5336, Twitter, hashtag Marsha, Facebook. Just ask us the question. And I'm sure if you'd like to see Dr. Shelby-Lane again, you'll drop us a line. Okay, so we had to get that out, because I know that our viewers will be impressed to know that there is a physician who is well aware and well versed in the knowledge of medical marijuana. So tell me, how does one become a patient first and foremost?
Well, the first thing is you have to, in order to get a medical marijuana certificate or card, you have to be, there's 24 states that have legalized medical marijuana. There's 5 states for recreational. So we don't have to talk about them, because Michigan is not one of those states, although the vote may come up the end of this year with the presidential election. But you have to be a resident of the state of Michigan. You have to have a valid ID, and it has to be valid. It can't be an expired ID card. It can't be an expired driver's license. Passport won't work. It has to be a valid ID. And then once you present that, you probably need to bring your doctor's records to make sure that you have a real medical problem as well. You have a bona fide relationship with me or any medical marijuana doctor that certifies you, but we want to see your records from your physician, your primary care provider, or any physician you're seeing. Some of the issues that are coming up around doctors who know their patients are using marijuana, and these are big issues, because if you go to a pain management center, because many of the cases are there for chronic pain. A person will come in to their regular doctor if they have to have a drug screen. The drug screen is going to show what? Cannabis, along with opiates, etc. If it shows up for cannabis, your doctor who's prescribing you opiates and other medications for your pain will say, well, I can't prescribe your medication for pain. But the use of marijuana sometimes reduces the need for those opiates and those other drugs. So it becomes a catch-22, and I've seen it happen. But even if you have a medical marijuana card, your doctor may not still refill your prescriptions for your regular medicines.
But what are some of the conditions that a person may have that will, qualify them to be a patient?
Okay, so that's category A, B, and C, but there's actually 400 things. But to keep it simple, category A is things, chronic illnesses such as cancer, HIV/AIDS, hepatitis C, amyotrophic lateral sclerosis, post-traumatic stress disorder.
Anxiety.
So I'm trying to memorize that sheet. You're putting me on the spot.
So, I'm just saying, because a lot of people are like, well, I'm not just want to smoke it or induce it. I want to make sure that it relates to what my ailment is. The biggest things are chronic pain, anxiety disorders, glaucoma, again, like I said before, severe nausea, muscle spasms, and then there's this other category C. And if you go to michigan.gov/whatever marijuana, you will find, it's marijuana with an H, it's not the J. So you will find a whole list of conditions that are allowed, that would allow me to say the use of marijuana will help you. So there are numbers of conditions and debilitating illnesses. The list is getting longer. You know what's really interesting?
No, you don't know.
No, I don't.
Menstrual cramps. It's not even on the list. They might have PMS on there, but that's an area where I'm seeing a lot more women could use that, a product related to that.
Right.
And there are products in the market.
Okay.
There are for suppositories that are vaginal suppositories.
Wow.
Yeah.
Now, I'm not against medical marijuana by no means, but I do know in the employment arena, employers are frowning at this because they're saying, well, we're doing drug testing, and here it is, this person is an able-bodied person to work for my company, but they failed the drug test.
Right.
So there's no blanket to cover a person who is actually in need of the medical marijuana and employment at the same time. And I think the problem mainly is the type of job that you're performing may not allow you to comfortably be able to,
function
right
while under the influence.
Right.
Of
Now,
marijuana.
I wouldn't say, a meat cutter or a person driving a tractor trailer or a pitchfork and all that kind of stuff, you should really step down if you're going to have the medical marijuana and not do that kind of job. But I think in functional levels, to keep the pain down and you're not overdoing it, you should be able to let your employer know that I am on this medication or I am being treated. I don't think we necessarily have to tell them what it is, but I know that I had an incident where my mother had a Finland patch, and that Finland patch just wiped her out.
Yeah.
And then as soon as we take it off, about a couple hours later, she'd come back to herself. And I was just so angry. And so whenever she was in the hospital, I said, whatever you do, don't put one of them Finland patches on. They said, don't. I said, no.
Yeah.
And the doctor was like, well, she said, don't put it on that. And I knew my mother was in pain of some sort, but I didn't think she was in that much that it had to knock her out, and then you had to take it off to bring her back. I think that's too much.
Well, it's opiates. And so fentanyl, Percocet, the drug that apparently Prince had, those are the kinds of drugs that really knock out the pain, but sometimes when you get the opiates, it works against you. It doesn't even help the pain anymore.
Eventually.
So you up the dosage and the patient's knocked out. The workplace, you can't, there's no control over the employer, the workplace policies, what they do. If an employer says you can't smoke marijuana, we do a drug screen,
that's just it.
You're out of it. You're out of that job.
Well, I think, in the years to come, we'll come around to the table and, deal with it. But what is your take on the type of methods that a person should ingest it?
Okay, so let's go back to marijuana, the plant. Marijuana, the plant, 10,000 years, and they did the research. You break the plant down into its components are CBD and THC. And when you look at CBD, which is like the good cousin of THC, THC is the one that has the psychotic component.
Okay.
So if you do CBD in a proper amount related to THC, then you may not have as much of that psychotic effect. CBD alone may work. So the kids who are using CBD in Colorado for seizures, I don't know the whole story behind that, but those are the ones that are going to take it probably by tincture or oil. You're not going to give a kid any joint to smoke.
Right.
Sorry, it's a joint.
Well, I'm thinking, in terms of us legalizing it, that it means it comes in different formats, so that you can feel like, okay, well, I'm not a junkie or anything. This is medication.
Right.
So,
it is medication.
Right, and a lot of people don't want to eat it. Some people want to know if they can have it, ingest it and put it in a couple of drops in their tea or something or whatever, or put it in some type of not a syringe so much, but one of those things that when you're feeding the baby, you're trying to get the medicine in. So something that makes it a little more, less intense about, that's marijuana.
Yeah.
That's, I mean, here it is, a baby's having seizures one after another every 15, 20 minutes or every hour.
Yeah.
The parent is worn out because they don't know what to do for their child. Then someone comes along and says, give my baby, some medical marijuana,
so
and they calm down. But I tell you what, you get to answer that when we come back.
Appreciation. Pass it on. A message from the Foundation for a Better Life.
Over 1 million Americans at risk of foreclosure have been helped by making home affordable. Find out now what your options are.
And welcome back to the last half of the show. Now, ladies and gentlemen, I know I stopped Dr. Lane right in the middle of a good sentence about the trying to make sure that the children are covered, and so she's going to answer that question for us. But I'm going to tell you something. This is the kind of information that you want to know and you want to become more aware of. If you're in pain, chronic pain, and you're tired of taking pills and everything, you want to meet with your physicians and ask them about what is legal and what is the right way if you plan to take medical marijuana. So in that event, you need to find out what the laws are, the legislation, and everything, so that you will be on the right path and your house won't be just tore up because the police say, hey, you're not legal. Well, you can become legal. So check out the information. If you don't get the information, give us a call or drop me a line. So, okay, we were talking about, now we're getting ready to talk about the children. I'm so sorry I had to cut you off. But so what were you going to say about if a parent has a child having seizures and all that kind of stuff, and here it is, they want to give their child the medical marijuana?
Right, you need to have proper guidance for any of that for children. So I don't take care of children. There is an organization here, and I'm working with those guys who are helping parents understand how to administer marijuana to their child. For the children, they're not smoking, they're not inhaling, they're not vaping, they're not dabbing, they're not doing any of that. They're doing a tincture or an oil.
And what's a tincture?
A tincture is a more concentrated form of marijuana, but it comes, you can give it sublingual. You can give it through the mucosa. Okay. So the absorption rates are really interesting with marijuana as I keep learning and learning and learning. If you inhale it, that's in your system almost immediately within 2 to 3 minutes. It lasts about 2 to 3 hours. There are concentrated forms, what they call wax concentrates. Those get higher concentrations. They probably last about the same time. The mucosal component, so you can give it rectally, you can give it orally, you can give it vaginally. It's not really accepted here in Michigan yet. It's only out west, Colorado, California. Whoopi Goldberg just has a product out for women and menstrual cramps. So that's another route of administration. We talk about routes of administration. The biggest place where they're doing work with kids is in Colorado. We're doing some things here in Michigan. I can't give you the name right now, but I'll come back and let you know. And I'm constantly reading every
Somebody's
day.
saying, who is it? Okay. All right, okay.
Because if you want to know, you know what? You find out, you get in touch with us. We'll let you know, because I'm working with some of the best guys here in Michigan.
Okay.
So.
And, and I can see that you're into this, 110. I mean, really, because you're not just a physician, you're one with a heart. You care, and you want to make sure that your patients and those beyond are, given opportunities to, heal themselves. Or do you follow holistic care?
What do you mean by
more natural care, where people actually, a lot of people don't like to go to the doctor anymore, and the insurance is so high. So some people believe in doing more herbs at home and colonics and purified water, alkaline water, things of that nature. Is that something in your practice, or
Absolutely.
Okay.
Yeah. So my practice is functional medicine, which means looking at the function of your body and trying to heal your body from the inside out, as opposed to giving you a pill or a salve or anything. Even with pharmaceuticals and nutritionals, it's still something that's functional about you, your makeup, the way you think about life, think about health, think about your wealth, think about your relationships. So I really try to look at the whole person. It's very difficult because there's a psychological component and an emotional component to healing, even with marijuana. And I always tell patients, I said, so what are you going to really do to solve the problem? Because marijuana is a treatment modality. So if you're not really going to change some behaviors and do something differently, then marijuana is just like
an added component.
Zoloft's, Vicodin, or any of those other things.
Right.
So I try to make sure that your diet's good, reducing inflammation. If you're anxious, why are you so anxious? Not because your weed bag is low, okay?
She said it. Not because your weed bag's low. But well, I mean,
those are real answers.
Right.
It's real day.
And
I'm a
real
doctor,
questions.
and I can't be a sterile doctor in a relationship with people. They have problems, and so I went into medicine to be a healer, and this is fascinating to me. It's just fascinating. And I don't want to let it go, because I've done emergency medicine, I did surgery, I'm doing the functional medicine, hormones, diet, nutrition, food, But then marijuana comes up, you don't know what else is next. You just don't know. So I just think I want to be the whole doctor.
Well, and you are, okay. Okay. Well, you've come full circle, okay, and like you said, the ER, the whole nutrition. So there's nothing wrong with where you are today, because if you were brand new as a doctor, then we might have questions she's just graduated.
Doesn't really know what she's talking about.
But you're talking about time with history, so that you can know that what you studied is bona fide.
Yes. Absolutely.
Okay. So
and I'm doing the science and the research, so don't just.
And believe me, we have you here.
I'm reading the books. I'm reading the books, so I'm just not throwing out statements with no background. Because every time I get a question from a patient, I'm like, let me look that up. No, not WebMD. I'm not talking about that kind of look it up, where you can look it up at the same time. I'm doing the real hard research. I'm going to the conferences, and I want to make sure my patients are still safe.
Right. And that's a good thing. That's a good thing, because at the end of the day, when we go to our physicians, we're telling our physicians we have a problem. What can we do about it? You know, can you fix it? Can you heal it? And however it comes out, the outcome is to get better.
Yes.
Okay. So the outcome is to get better at all costs. And I'm just impressed with the fact that we still have the opportunity to have medical marijuana on the table for discussion.
Yes.
But then there is a group of physicians like yourself who are, spearheading the discussion, so that the legislation just don't throw it in the trash and say, again, not again.
Right.
We're not going to go through this again.
Yeah. I do plan to go to any congressional hearing. If I go to Washington, I go to the state level here. But I have to learn so much more to make sure that when I say it, I can say it with confidence, and I have it backed up. There's lots of research that's been done. There's tons of it. So just my eyes stay open.
And I just have one more quick question. Now, as a physician, that you say a physician has to write a prescription. How long does a prescription go?
So that's not right. So I can't write a prescription for marijuana. You can't go to the pharmacy and get it filled.
Correct.
It's a Schedule I drug. I can make a recommendation for use of marijuana that would benefit you for your health problem. You then go to a dispensary to buy it. You have a caregiver who can get it to you, or you can grow it at home. You can have 2.5 ounces in your possession. You need to have that card with you. And you can grow 12 plants at home. You figure all of that out on your own. I have nothing to do with that part of it. But finding a good dispensary, finding people who have the right strains. So there's sativa, indica, hybrids. There's all sorts of strains. There's tons of strains. But so you want to go to someone who really knows, a grower type person who knows the effects of that plant. Okay.
And that way, so when you meet your clients and everything, they say, okay, I have a chronic pain in my lower back, and is it possible, Doc, I can get, medical marijuana? That's a discussion.
That's a discussion about being eligible to use marijuana for the treatment of your problem, but it's all self-medicated. So I don't write a prescription out and say 2 joints a day. I don't do that.
That's why she's funny.
You decide what you're going to do. But then when you come back for renewal, or I call you in like 7 or 8 months and say, how's that working for you? Is it working out? And I always ask the patients, what's the best form for you? Inhale, vaporization, wax, concentrates, dabbing, edibles. When you have an edible, you eat it, maybe 12 hours later, you're going to feel that effect. It's going to take about that. It depends on your transit time.
I believe it. Okay, well, Dr. Lane, will you come back and join us again?
Absolutely, Marsha. I would come back. I will be on this show. This is a fabulous show.
Okay, thank you. Because I'm telling you, we're not done. And somebody's like, you didn't ask this. Okay, so we'll ask it next time. Okay, so we're going to make it real soon.
Okay.
Well, ladies and gentlemen, I'm your host, Marsha Once with Just Ask. I always tell you, if you have a question, you need to email, Twitter, Facebook, hashtag Marsha at Just Ask Talk Show. 1-800-323-5336. If you have a question for Dr. Cynthia Shelby-Lane, go to our website, drop us a line. We'll get it over to her. Promise, okay? So I'm your host, Marsha Florence with Just Ask. And what do I always say? If you know someone with a disability, or if you just have a general question, don't be afraid to ask. Just ask. I'm your host. Thank you.